morning, everyone. Anal fissure and piles. Both the ailments are anal rectal disorders. How can Ayurveda help? Is there any evidence or research? We're going to explore all these questions with Vaidya Sharad Kulkarni, who is an award-winning Ayurveda doctor. He is an expert on anorectal disorders. I am Amita from Nourish Doc, a global platform for natural and holistic therapies. I am super excited to introduce all of you to Vaidya Sharad Kulkarni. Welcome, Dr. Vaidya. Welcome, Dr. Sharad. Sorry, not Dr. Vaidya, Dr. Sharad.
Yeah, thank you very much for the introduction. And
Well, we can laugh at least.
sorry for the slight delay. And we are here, and I'm very much excited to join from India. So it's 9:38 p.m. here. So we'll just go ahead with some of the treatment aspects of Ayurveda for anorectal diseases. So anorectal disorders here can be piles, fissure, fistula in and anal polyp or rectal polyp, and many such diseases. Just starting from fissure and then ending till carcinoma. So all these will be considered under anorectal disorders. Especially the piles and fissure or the hemorrhoids is what we call for the piles. The medical term always has been associated with social embarrassment, wherein a person may have to strain himself or herself for the defecation, and then finally ending up passing streaks of blood or splash in the pattern of the bleeding during the defecation, painful defecation, or more or severe kind of pain post defecation. So these all are kinds of social embarrassments, because if they are associated with some of the intestinal disorders like ulcerative colitis or IBS, then if there is a social gathering wherein a person has to go ahead for defecation, then there will be lots of embarrassing moments because of these kinds of symptoms. So to just introduce you to some of the anorectal disorders, the first one being the hemorrhoids. These are extremely common, and they affect approximately 10 million people per year. And one of the study has estimated that over 50% of the US population who are above 50 years have experienced hemorrhoids. And similar thing is with the fistula. Of course, the incidence of anal fistula is though lesser than hemorrhoids and fissure both, but it is more socially embarrassing condition, wherein there would be always the soiling of undergarments with the pus. The pus may be just serous discharge or purulent or serosanguinous, that is pus plus blood would be mixed, and it would be discharging from the external opening, which is a pathognomonic feature of fistula, anal fistula. And then we have anal fissure, which is very much common in most of the people. Some or the other day in the life, everyone would have been suffered from anal fissure, and they would have neglected it just by taking some small home remedies or some of the precautions or some of the herbs, which we would be dealing with in the upcoming slides or in the subsequent slides. And anal fissure is nothing but a linear tear in the anoderm distal to the dentate line, and it can be acute or chronic. Now, like for example, acute means this, if consider this is the anal canal or this is the anal opening, this is the anal canal, and the feces is being passing through this opening, and if it is very hard, that is hard stools, then what happens is it tends to injure the anoderm, and there will be a linear cut here, and then from that cut there emerges streaks of blood and also severe pain. The severity of the pain, we consider it as severe because it will be a linear tear, and this is acute anal fissure. If this crosses 6 weeks, if this episode has happened and there is lots of negligence and there is no attendance to this kind of condition, then it becomes chronic anal fissure, which may be associated with sentinel tag or skin tag later. So that is a chronic anal fissure. And then we have anorectal polyps, which may turn into like carcinoma, or which may turn into cancer in the later stages. So it's always better that we deal with all these kinds of diseases, starting from hemorrhoids, and then anal fissure, and then anal fistula, and then rectal polyp. So some of the common symptoms, previous slide please.
Sure, sorry.
Yeah, some of the common clinical features which a subject would be experiencing during any of the anorectal disorders can be as follows. Pain which is of burning type or of cutting type, like something is being cut, that kind of pain, or something is being burnt, burning type of pain, or we can call it as burning sensation also during defecation or after defecation. It may persist for 1 hour, 1.5 hour, 2 hour, or so on. And then constipation, which can be a root cause for all of these diseases. Most of the times, constipation or hard stools is the root cause for all of these conditions, and which is nothing but obstruction for the movement of feces, or it may also be like obstipation, wherein it's a complete constipation, wherein intestinal disorders are also associated with this, wherein a person will not be able to pass feces and flatus both. So here it's only the feces, wherein it will be very hard, and then due to overstay in the lower part of the intestine, overstay of the feces in the lower part of the intestine, most of the water gets absorbed from that stool, and then it becomes harder, more harder. And then at a point of time when they try to strain, so if the feces pass out, then there would be anal fissure. If it is not passing out, then there would be an engorgement of veins causing hemorrhoids. And then mass per rectum or mass per anus, wherein there will be a mass which can be coming out from inside during the straining process of the defecation, or there may be a mass which is existing outside the anus itself or the anal opening itself, which can be a sentinel pile or a sentinel tag, usually seen in chronic anal fissure. And then discharge, wherein there can be a mucoid discharge if it is internal hemorrhoids or interno-external hemorrhoids, which are the types of hemorrhoids. And if it is grade 2 of interno-external hemorrhoids, wherein the mass is coming out and it is going inside automatically, it's receding automatically, it's grade 2 piles, interno-external piles. There also we can see mucoid discharge. And then bleeding, definitely if it is with pain, then it will be anal fissure, and if it is painless bleeding, usually it will be piles or hemorrhoids. So itching because of the moisture, because of the mucus discharge, usually seen in piles, there can be itching. And soiling of undergarments, which is the pathognomonic feature of anal fistula. Next slide, please. A small differentiation in between piles and fissure for those who are still confused. I think we can take it up in the upcoming classes also. But piles versus fissure is a most frequently discussed topic, because most of them would be unaware of what piles is exactly and what fissure is exactly. So piles are caused due to venous engorgement, usually because of overstraining during defecation. This is what I was talking about. If the motion is very hard, if the stools are very hard, then if that subject or if that person tries to strain or overstrain during defecation, if the person pressurizes the urge for defecation, then there would be engorgement of the veins, the hemorrhoidal veins, and then they would be reflecting as piles, wherein as in fissure, the hard stool just passes out the anal verge and it cuts through. So there will be a cut in the anoderm, a linear tear, a wound. That would be a fissure due to the injury which is caused by hard stool. So somewhere hard stools is the culprit. So usually we always tell that keep your gut clean. So this means that the motion or the defecation or the stools should always be soft, so that you are not going to strain more. Of course, we have other reasons for fissure also. It can be any kind of injury, external injury. So, but that percentage is very less. It may be around 10 to 15%. The rest of it is usually constipation. So in our OPD, we have been treating anorectal cases, especially the fissure and piles and anal fistula. So fissure cases, we have treated around 700 fissure cases successfully with one of the oil pushing technique, wherein we take the medicated herbal oil and then we push it in the anus, so as there will be relieving of the sphincter spasm. There would be anal sphincters which usually contract. If this is the anus, there will be anal sphincters which are nothing but the muscle fibers. They'll usually contract because there is a wound, so it will not allow the feces from outside, from inside to outside. And then if we are trying to examine it with the digit or the finger, digital rectal examination, it will not allow from outside to inside, because there would be severe pain and there would be sudden stimulation of the nervous system. So there would be a sphincter spasm which we have to relieve at any cost. Usually in surgery, there would be a sphincterotomy which would be performed. So what we do is we push lukewarm medicated herbal oil into the anus. Around 20 to 40 ml of lukewarm medicated herbal oil would be pushed into the anus, wherein it will help for relieving the sphincter spasm, that is improving the sphincter tone, and then subsequently healing the anal fissure. So one of the Ayurvedic therapy, which we usually call as the hallmark of Ayurvedic surgery, that is our Shalitantra, is Kshara Sutra therapy, which we majorly use it in pilonidal sinus and fistula in ano cases. And it is one of the gold standard technique, wherein it is a OPD technique and it is very easy, affordable, and kind of day case or day care surgery or parasurgery. So it is safe and cost effective method for fistula in ano, and even hemorrhoids. Sometimes we, if it is internal hemorrhoids, we treat it with Kshara or sometimes Kshara Sutra also, and pilonidal sinus also. Next slide, please.
So maybe you can just explain to our viewers how Kshar Sutra therapy versus the conventional medication or conventional surgery that one might have to go through, right? So maybe you could talk a little bit about that as well before we go into how does the Kshar Sutra work. Like if someone has hemorrhoids or someone has anal fissure, they might have to be admitted in a hospital, right? Versus in Kshar Sutra.
Next slide, please.
Yeah, no, I have the slide here.
Oh, after this.
Oh, after this, we'll talk about that. Okay, all right.
Just a second. Next slide, please.
You don't want to talk about the procedure, or you want to go?
We'll talk about it. Next.
Okay, slide. All right. Okay.
So when we compare Kshara Sutra, which can be a good option to surgery. So here we usually treat without any antibiotics, and then as you can see, we have the red color words which is written as Kshara Sutra, and this is taken from a research article by Dattaji. And if we can see from the external opening to the internal opening, we have a Kshara Sutra which is tied, and then this is a very OPD based procedure, and it is safe in patients who have chronic conditions also, and no antibiotics will be used. It is cost effective when it is compared to surgery, and minimal scar formation on the affected area, and we use completely the herbal pastes which are pasted on the thread, the barber's thread, and then we turn it into Kshara Sutra, and then we have 95% plus success rates. So it is 95% plus, and recurrence is very, 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 very minimal, or it's nil if it is performed methodically. So please take it for granted. And very much scary thing regarding AnoRectal surgeries is about the incontinence, wherein if we at all end up cutting more muscle sphincter fibers, then there would be incontinence, wherein a person would be passing the flatus or the feces without his or her knowledge. So that is one scary thing which usually afflicts most of the minds. But here, the chances of such injuries is very minimal, and incontinence is also very minimal. And one important thing is there is no hospitalization needed. It's a OPD procedure. We can just do the probing and primary threading once, and then a person can keep visiting once a week. We have certain protocols for that, and then every week or once in 8 days, which is a standardized thing in Kshara Sutra, which is a standardized repetition in Kshara Sutra. We just keep going ahead with weekly once change till the track is completely cut, or till the track is completely excised only through Kshara Sutra. There will be no cutting through the cautery, that is diathermy, electrocautery, or even the knife. Previous slide, please. Yes. Now, if we go ahead with mechanism of action of Kshara Sutra, especially in fistula, and pilonidal sinus, and even in hemorrhoids sometimes. So this is Euphorbia latex, Euphorbia herb, which we can see there. And then we have the preparation of Kshara Sutra, which is through the Kshara Sutra cabinet, which we usually tie it in this way, and then we keep it in the UV cabinet. And then Euphorbia latex has the proteolytic action, which helps to dissolve the fibrous tissue which is present in the fistula tract, and helps in the cutting. Apamarga is one more herb through which we prepare the kshara, and this is alkaline in nature. Basically, kshara means alkali, that helps clear the tract and liquefies the pus. So there would be lots of pus discharge during this therapy. So usually people feel that there is lots of pus discharge after the therapy. So is there anything wrong with the therapy? No, it's not wrong. It's absolutely fine. So if there is Kshara Sutra procedure which is going on, there will be a complaint from the subject that there would be most of the times there would be a pus discharge, and then you have turmeric, which can be antimicrobial agent, and then a good healing agent, and then anti-allergic, antiseptic. So all these properties have been attributed to turmeric, and then it has multifold benefits also, which are not the part of this discussion, but of course they will be helpful also. So next slide, please. Yes, when it comes to the treatment of the hemorrhoids, so we had a 35-year-old male subject who visited the OPD with mass and bleeding, and who was not a known case of diabetes mellitus and hypertension. So on proctoscopic examination, he was found to be suffering from second-degree piles, which I told you that the internal mass would be protruding out during the defecation, and it just goes inside, or it recedes back automatically. It retracts back automatically without any efforts. And he was advised diet and lifestyle corrections, and along with that, Sitz bath is very important. That is a tub bath, which we call as Sitz bath, with plain lukewarm water once a day for 5 minutes is very essential. And then we have a patent medicine called as Proctapi, which we had given one in the morning, one in the afternoon, one at night before food. And then we had a kind of herbal laxative, which is nothing but the Triphala powder, the mixture of Amalaki, Haritaki, and Vibhitaki, which was 1 tablespoon with warm water only at night, which was also before food. And then he was advised to have no strainful defecation. That is, he will not pressurize during the defecation. So the herbs which would be beneficial in case of piles would be Triphala, as I have already mentioned. Ginger in very small quantity, it can be half a pinch. Then Mimosa pudica is the touch-me-not plant, which will be helpful to arrest the bleeding if there is any bleeding per rectum. So in 15 days, there was a considerable reduction with respect to both mass and bleeding. Of course, the mass will not regress completely with the medicines. Sometimes it may need surgical intervention, but there can be a regression or reduction. So this is the term which I would like to use. Because of the no strain defecation, there would be regression in the mass, maybe 5% or 10%, but there will be some regression in the mass, and then the bleeding was stopped. Next slide, please. And then we have anal fissure, wherein we had a female patient who was not a known case of diabetes mellitus and hypertension, visited the OPD with severe pain post defecation and during defecation, with streaks of bleeding. Streaks of bleeding here means the drop-wise bleeding, or bleeding along with the feces, along with the motions. So on examination, she was found to have acute anal fissure with sphincter spasm. So we will not usually examine with a digit, wherein if we find it that it's acute fissure, and if there is sphincter spasm, there may be sudden shock because of the pain. So we'll not be examining through the digit very deeply. So it will just be a very minimal or superficial examination here. So she was advised to undergo the oil filling, or Taila Purana is what we call for this treatment, for 7 days along with the medications, and then Sitz bath. So golden rule in treatment of AnoRectal diseases, which we'll be seeing in the upcoming slide, is Sitz bath. Very important, Sitz bath. So I have made a video also on this, which is on YouTube if you search it on my name. And Triphala powder, the herbal laxative, was suggested, 1 tablespoon with ghee and hot water at night. And Triphala Guggulu is one of the tablet which was suggested, 1 in the morning, 1 in the afternoon, and 1 at night before food. Jatyadi Taila is one of the herbal oil which contains many of the herbs. That was suggested for external application post Sitz bath. So once the Sitz bath or the tub bath is done, then they have to dry the area with a clean cotton towel, and then they have to apply the Jatyadi Taila little bit externally also, and then internally also, to the extent they can reach. And then Gandhaka Rasayana, which was 1 in the morning, 1 in the afternoon, 1 at night before food. So on the 8th day, the bleeding had completely stopped, and stool was obviously soft, and there was no pain in the anus during or post defecation. So this is one of the again gold standard treatment when it comes to anal fissure or acute anal pain. So any kind of acute anal pain except abscess, we can always go ahead with Taila Purana or the oil filling therapy. Next slide, please.
This is another one, I think.
Yes, this is the Kshara Sutra procedure, which was like done last year, wherein we had subject suffering from severe pain and pus discharge from the perianal area, and there was a severe pain if the subject was sitting for some time on a chair in the same position, which most of the IT people are doing these days. Not only IT people, most of the people are doing these days. Work from home, WFH, and on examination there was an abscess in the perianal region with soiling of undergarments and a sinus with external opening. So the internal opening we were not able to locate it properly, for which we had to go ahead with transrectal ultrasonography. It's an investigation protocol, TRUS, or endorectal sonography. So that's one of the procedure. Pre-op, it's a pre-operative procedure for Kshara Sutra or surgery both. And then the personal history was absolutely fine except the bowel movements wherein it was altered. It was altered bowel habits, sometimes constipated, sometimes loose motion, and sometimes absolutely normal. So we call it as altered bowel habits, which most of the individuals have who keep eating junk foods or who keep eating indisciplined in an indisciplined manner. So then we had Kshara Sutra for this subject after the truss and some of the pre-operative blood investigations, and then orally Gandhaka Rasayana, one in the morning, one in the afternoon, one at night, so before food with water, and then Triphala Guggulu, which would be helpful for the pain management, was administered, one tablet thrice a day. And sinus in the perianal area was reduced by 4 weeks of the Kshara Sutra therapy. Level of pain subsided considerably after the sinus got reduced. So since there will be a space, there will be pus, and then if there is pus, there would be pricking kind of pain. Like in fissure, we will have cutting kind of pain. So because it's a linear tear, and in fissure, we may have burning kind of sensation, during or after defecation. Likewise, in sinus abscess or anal fistula, there would be pricking type of pain, as if that area someone is sitting inside and pricking. So pus discharge was reduced significantly. Of course, during the therapy it was more, and then afterwards the track was cut, so it was reduced significantly. Next slide, please. When it comes to self-care, everyone's favorite topic. So I think Triphala in the form of tablet or in the form of powder is a very good supplement, is a very good herbal laxative, is a very good anti-aging drug or anti-aging herb for any of the conditions. And then very half pinch or lesser than that amount of ginger would be very helpful. Self-care, anyone suffering from painful defecation or post defecation pain in the anal region, or any kind of pain, discomfort, bleeding, then definitely Sitz bath is do it yourself therapy, wherein you have to go ahead with a wide tub in which you will be positioning yourself for 5 minutes once a day, wherein the anus would be dipped completely in the water, the lukewarm water. So the temperature of lukewarm water would be same as how much you take it for bathing. So for bathing purpose, whatever you would be taking, the same temperature would be considered for even Sitz bath. Next slide, please. So that's all for today.
Thank you so much. This is very, very nicely done. We have any questions from people who are joined us on Zoom? I see quite a few people on Zoom. So if you have any questions, Dr. Sharad can answer your questions. I can stop sharing if you don't want, your questions to appear. Before that, I'd like everyone to see our email and our website. But we are open for questions. If you want to ask any questions, you can put it in the chat window or ask us the questions.
Definitely, they can.
So, most of the cases, like you talked about, if someone is thinking about any questions, you said you have you did like almost 1,200 cases, like 700, I forget, 700 was for hemorrhoids or the 500 for fissure. But out of that, out of that, how many of them had to go through Kshar Sutra, the Ayurvedic surgery, so to speak? What was the percentage of that? Or, and I think that would help
When it comes
approximate.
to hemorrhoids and fissure, usually the amount of Kshara Sutra which would be performed would be less. Here we do the application of Kshara, which is the paste for the internal hemorrhoids. We do that, and then around 35 to 40% of the cases had to undergo with the application of Kshara. We call it as Pratisaraniya Kshara. And then in the fissure, we usually don't require Kshara until unless it is very much recurrent and it's very much notorious, wherein it is just recurring again and again. Then we may have to apply the Kshara on the wound itself. And in fistula, and pilonidal sinus, I think 100% of the cases require Kshara Sutra.
I see.
Yes.
Okay. And then, and how much time does it take for them to? Okay, I see a question coming up. So, all right, I'm going to stop share so anyone can ask questions in full confidence. I'm not sharing the slides anymore, so your questions are, your name is not going to be visible. Yeah, hi, Amy. Nice to meet you. All right, so can you put the link to your Facebook video? Yes, absolutely. All right, no problem. You can, we've started putting all the videos on our website as well. So I will send a link. But ask questions now for this particular session if you have any question. He's one of the award-winning doctors, Ayurveda doctors from Bangalore. He's treated a lot of these kind of patients and with a lot of success. So here's your chance to ask any questions if you want to ask right now. I was also going to comment on the healing time, right? For example, you said the entire process itself of Kshara Sutra is an outpatient. It takes 1 day, right? That's what we understood earlier.
20 minutes.
Oh, wow. 20 minutes, that's it?
There will be slight pain which would be involved in the therapy, and then it will be 20 minutes per sitting usually. And the total time for cutting and healing of the tract absolutely depends on the individual and on the length of the tract of the fistula or pilonidal sinus. And it usually ranges from 4 to 8 weeks. Usually ranges from 4 to 8 weeks.
4 to 8 weeks of healing time after that. Okay, so there is a question right now. What is the difference between the Western treatment procedure and the Ayurvedic one? I think there was a slide there, but maybe if you don't, I'm happy to share it, but if you want to talk about it, it's up to you, how you want.
I think we have already told about the upper hand of Kshara Sutra when it is compared to the surgery. And here, basically, we have no cutting business. It will be done with the thread. Of course, there will be cutting, but it will be done with the medicated thread or alkaline thread or the Kshara Sutra. And wherein in the surgery, we use diathermy or the scalpel, which would be used for cutting. And then here, cutting and healing would be done would be occurring simultaneously in Kshara Sutra. Whereas in surgery, it's one shot, one go. We have to just cut it completely. Healing time here and there, it will be almost similar, but recurrence chances in surgery, as per most of the research studies, is higher when it is compared to Kshara Sutra, because when we go ahead with one go cutting or one shot cutting, since that is a contaminated area because of the feces, there would be more likely chances that there would be a recurrence of fistula or even pilonidal sinus because of the pus, because of the moisture, because of the motions with respect to fistula. So all these things increase the recurrence rates. So that's how I think Kshara Sutra is always better as of now. Even many of the international texts have been mentioning Kshara Sutra these days.
So let's say, let's just, is that clear, Amy, for you, or you want to clarify a little bit more? I just want to make sure that the answer is clear. So let's say someone has, just to elaborate a little bit, just as someone has this issue and they go into a doctor, and then the surgery part of that will take 1 day because you put the anesthesia to that person, right? I'm just assuming, and then they cut it open, as opposed to someone going to an Ayurvedic Kshar Sutra is a 20-minute procedure as opposed to no anesthesia, right? That's what I just want to make sure comparison, right? Tell me if I'm wrong.
Thank you, Amy, for the question, and it's my duty to answer you.
Okay.
As a part of daycare surgery, both are the similar things. But when it comes to post-op care, in the surgery, it would be more. You need to do it with recurrent dressings, and then you need to take care of the wound a lot. And it's almost like you will be missing your routine, because not immobilized completely, but of course you'll be missing the routine because of the pus discharge usually, and because of the frequent dressings, which may be once in a day or once in 2 days. There is alternative days. So that would be making huge difference. That whole dressing procedure post surgery will take around maybe 15, 20, 30 days. And
someone has to go back. Someone has to go back to the hospital to get the dressing done, right? But in Ayurveda, you don't have to come back for anything. That
for the thread change, they have to come.
For thread change, okay.
For thread change, they have to come back to the Ayurveda clinics, and of course there will be slight pain which is involved, which would be hampering their routine for 1 or 2 days, maybe 48 hours post thread change. But after that, they'll be absolutely normal. And those who are working from home, they can keep working usually.
Okay, so hopefully this answers your questions, Amy. If there is any clarification, please feel free to say that. Okay, someone is asking medicine for painful fistula.
Okay. I have been telling this again and again. I have shot around 2-3 videos also, which are on YouTube with a high viewership, that medicines will not be of much help for fistula and ano. Like only medicines will not be, I'll correct the statement, only medicines will not be of much help for fistula and ano, treating fistula and ano. It should be combined with the cutting of the tract, which can be achieved by 2 things. That is, one is surgery and second is Kshara Sutra. Along with that, we can go ahead with medications. The medications I've already mentioned, which are very simple to procure: Triphala, Guggulu, and Gandhaka Rasayana. 1 in the morning, 1 in the afternoon, 1 at night, each before food. That will be helpful to relieve the pain with respect to fistula and ano. But if there is a pus collection, there is collection of pus, then it has to be incised and it has to be drained. Wherever there is pus collection, it has to be drained always as per any science, because if the pus stays inside, there are all the likely possibilities that it may invade the deeper structures. So it is always important that we just drain it out. I hope I have answered your question. Thank you.
Yeah, okay. Any more questions? I've written our email as well. If you can't think of all the questions, you're welcome to email us. And, Dr. Sharad can also do consultations. So if you like to, do any consultations as well. Any more questions before we wrap up? Okay.
So I think many would be watching on Facebook Live also.
Yes.
Thankful to you.
Yes.
And those who have been on Zoom, thank you very much. And this is Dr. Sharad Kulkarni signing out from this webinar. And over to you, Amita.
Thank you so much for joining us, as always, Dr. Sharad. And I hope we answered all your questions. Please share our sessions. We are advocating natural therapies with science and research behind it. Have the great rest of the Sunday morning. Who are in the, who are in US and Canada. For you, all of you, good night. Namaste. Thank you.